Well, they shouldn't be going around with their mouth open. They should be nasal breathing. They've straight away got a myofunctional problem if they're not nasal breathing, in and out all the time. Constant yawning, sighing would be other airway issues. Even if you look at your lips, the upper lip is meant to be very slightly thicker than the lower lip. We see it in the opposite way in so many people, and it generally is telling us that this bit of the face hasn't actually come as far forward as Mother Nature would have intended. So it's lacking the support of that forward push, and it falls inwards and the lip folds in, reducing the size. If the lower lip isn't being used, you get a very flaccid lower lip and it's just hanging out like this. You can have a lot of venous pooling under the eyes. You'll have a narrow, long face. You'll have crooked teeth. You'll have maybe a gap between your teeth where your teeth just don't come down into the right match, where the upper teeth come slightly over the lower teeth. This is a big player in it. So this muscle is very often used to help us close the lips, and we don't need that muscle at all to close the lips. We have one muscle to close the lips and it goes right around here. It's a ring or a sphincter muscle, and that's the only muscle we need to close our lips. But very often we use this muscle and we give it a big squeeze and we close it. But this muscle is for facial expression. It's not to be used to close your mouth, and it causes a lot of trouble when it's overactive. Adults come in, and again they're mostly presenting in pain. They present with headaches, migraine, neck pain, shoulder pain, poor sleep, even chronic fatigue. And we let them know that it's poor muscle function has got them to that place, that the poor muscle function has resulted in poor facial growth, and that if they improve the muscle function while we're giving them more tongue space, we can really help them and we can stabilize them. And we very often find that in tandem with that result, we have an alleviation, if not a complete mitigation of the symptoms with which they present. As you know, teenagers are particularly at a point where they become very, very aware of what they look like, and there's a lot of peer pressure. It's a time where I find they're good to work with because there's a motivation there. They actually want to get better. They don't want crooked teeth. If their teeth are straightened, they don't want to go back to having crooked teeth. So we very often find that they're well on board with you and that they'll do the exercises. They don't want to go around with that mouth dropped open and the tongue hanging out because there are connotations about that particular look. They don't want to look like that. Well, if a teenager is having any kind of orthodontic treatment, obviously there is far less likelihood of relapse if they correct the muscle function. So that goes for all teenagers, all adults, it goes right across the board. With myofunctional therapy, for anybody, but again for teenagers and adults, a lot of them are into sport, they want to excel, they can be competitive, they want to do well at school, etc. And when you establish nasal breathing allows you to concentrate much, much better, because there's a whole physiology that occurs in the blood which allows you to deliver oxygen to the muscle and brain cells far more efficiently and at a much faster rate. So it means that if you're doing any kind of sport, your muscles are getting the oxygen it needs much, much faster and far more efficiently. So your endurance and your stamina are going to be increased, and you've suddenly got an advantage. And that's exactly what Patrick McKeown talks about in his book, The Oxygen Advantage. And that is there. So when teens and adults come in to me, I explain what's going on in relation to this oxygen advantage, and I say to them, if you can switch from mouth breathing to nasal breathing, I'm not telling you you might get better at sport. I'm not telling you you might get better at school. I'm promising you it. And they're very impressed by that. You know, you've got a lot of compression here in the jaw joints, and chewing can further compress. But we find that once you put in an appliance that helps them decompress here, so they get a lot of relief here, you can fairly much start working with them and build up the muscle strength so that it supports the decompressed lower jaw as opposed to supporting a compressed lower jaw. The appliances work wonders with those TMJ patients, they really do. Particularly these alpha appliances, because they don't take up tongue space. It seems to result in decompression here, and when you have the decompression here, you have pain relief. And I would be working on muscles then to support that new occlusion that they're moving into. But generally I can give them some immediate exercises just to help them decompress, but I work with them fairly soon after these appliances go in. So if we have a tube, a breathing tube here in the throat, this is the collapsible part of the airway. Now it's slightly supported at the back, but the whole front of it is collapsible. And if you're not working those muscles, and there are many muscles that I'm talking about in this whole area between the chin, this hyoid bone, and right down to the clavicle or the collarbone and the breastbone or the sternum, if you're not working those muscles, and they're all the ones we work in myofunctional therapy, you're going to end up with flaccid or flabby muscles. And that's where you have your apneas.